I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, episode 56. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
We're talking today about a plant-based diet. Is this something that's good? Is it something that's manageable? Is it something that's doable? Where do you get your protein? Where do you get your calcium? How do you get enough calories? What if I lose too much weight? I love that one. You're not going to lose too much weight. Don't worry about that. So we use the word vegetarian, and vegetarian is kind of like an outdated word now. Vegetarian is somebody who doesn't eat meat, but there's lacto-ovo vegetarian. They'll eat dairy and eggs. There's pesco vegetarian. They'll eat fish, but they're not going to eat land-dwelling animals. Okay, I'm okay with that. Any step is better than none. The new phrase now, because you can be a sick vegetarian, and over the years, I've had so many patients come to our offices just because I'm a vegan. I don't eat animal products. Well, I'm looking for a vegan doctor. I'm looking for a doctor who understands nutrition. I'm looking for a doctor who understands my lifestyle. Because I can't tell you how many patients come in and they'll say, well, my doctor told me I have to eat meat. And I said, well, I don't want to eat meat. Well, you have to. And the doctor walks out the door. Well, that just is, and I don't mean this in a bad way, ignorance. They don't understand. Nobody has to eat meat. Nobody has to eat animal products. But in a limited world of knowledge, and again, I'm not an expert in everything, but if you don't understand the importance of a plant-based diet or the benefits or how it can be done, you automatically just revert back to, well, that's it. You got to eat meat, and it's done. And so we get a lot of patients from that, which good for us, I guess, good for the patient. But people always say, what do you eat, Dr. Joe? And that's the biggest question. Well, where do you get your calcium? Where do you get your protein? And what do you eat? The cool part is 30 some odd years ago when I decided to venture down this path, I remember it took me a few months to do it, to make my final decision. But the last time I had meat was Christmas Day, 1986. I had spare ribs at my parents' house, drove back to Georgia. And I was so poor, I just graduated school, graduate school a couple of years earlier, but I was so poor that I was delivering pizza at night to pay my rent during the day on my office. I only had one then. And I always had this fear. And my biggest fear was that I was going to deliver a pizza to a patient. Imagine your doctor coming to the door. Here's your pizza, Bob. See you Tuesday. Walk out the door. And I always had, and I never did, luckily. But I didn't have any patients back then either, so it was easier. Now I can get away with that. But I remember I was so poor that I couldn't afford meat. So there was a grocery store called Metro Grocery, and it was a bicycle ride. It's about 2 miles from my house where I lived, my apartment. And I'd bicycle there with the newspaper bags. I used to deliver newspapers when I was a kid. And I'd load up whatever they had on a discount rack on Tuesdays. And that might be beans, dented cans of beans or whatever, vegetables, rice, 4-day-old vegetables, artichokes. And I started eating that way, and I started feeling really good. And I started thinking, what am I doing differently? My sinuses aren't running. I have more energy. My stomach flattened out. What am I doing differently? And so I started thinking about it, and I realized that I'd gone accidentally vegetarian. It was a mistake. I didn't mean to, but I hadn't had meat in a while, and so I decided, I wonder what's going on here. So I was working on my first degree in nutrition. I have essentially 7 degrees. So I was working on my first degree of BS in clinical nutrition, and I realized the only diet that made sense was a plant-based diet. Because all the other ones had the pros and the cons, but there was no con to a plant-based diet except for the fact you had to make sure you're getting enough B12, and that's one of the downsides, but that's easy to fix. We have a supplement called Dr. Joe's B Complex, and also the Essential Source. We put B12 in there, so you can get it from a supplement form, which is easy. You could use nutritional yeast if it's fortified with B12. You can take a B12 supplement, but really the only thing that we're missing as vegetarians is B12, because the animal eaters, bacteria break down the protein, and one of their waste products is B12. So when flesh is being digested by bacteria, when the meat is aging, it produces B12, and then you get your B12. But you can also get it just from bacteria and fermentation, so that's how I get mine. But back then, there wasn't a whole lot of choices. I mean, I remember thinking, am I going to do this? If I do this, I'm going to do this forever. You know, when I make a commitment, I make a commitment. And I was raised Italian. Your word is worth everything. And so it took me a while to think about it. And in the meantime, I was doing well. And I think, can I ever give up butter? Can I ever give up scallops? Can I ever give up double beef cheese hamburgers and meatball sandwiches? And after a few weeks, or a few days, actually, if not even a few weeks, I started going, yeah, well, I could do this. And then I decided I'm going to do it. And I went, the whole way. But back then it was salad and beans. That was it. That's all you had. But now restaurants, I can't think of a place I've ever been that I couldn't get a plant-based meal. And that's been 30 some odd years now. So restaurants are responding great. National Restaurant Association reports that 8 out of 10 restaurants in the United States have table service offer vegetarian options, which is pretty cool. 8 out of 10. I would probably say that's a meal. If you get creative, you could always make yourself a healthy meal. You could always do side dishes. You could do I remember going to a steakhouse one time with a bunch of friends of mine. And all my friends were eating steak and meats and everything like that. And I just looked at the side dishes, and they had a salad, and they had broccoli, and they had baked potatoes, and they had mushrooms that they did in olive oil, which was fine. And they had sauteed Brussels sprouts. And so I had this big meal in front of me, and they had a little piece of steak with a baked potato. My meal was like $8. Their meals were like $20. And interestingly enough, a lot of them didn't even eat their vegetables, and they gave them to me. So I had take home that I didn't even buy, that they did it for me. And I remember the night, actually, too, because a friend of mine had tickets to a place called Chastain Park in Atlanta, and Natalie Merchant, who was the lead singer for 10,000 Maniacs way back when, a big fan of hers, she was playing, and he had tickets, and he said, you want them? And so I got to go there, too. So I got an $8 meal, free tickets to a concert, and they were great seats, and leftovers to take home. And whenever I'm out, and I don't make a big deal of my lifestyle when I'm out in public, people always say, oh, that looks so good. What did you get? Because it's a plant-based dinner. I went out with a bunch of urologists a while ago with a friend of mine. He called me up. He said, hey, come out with me. I'm going to meet a bunch of urologists. I said, okay. And we went to a steakhouse, and they're having drinks and steak and everything. And I said to the waiter, I kind of whispered, hey, listen, I don't eat meat. Can you do a veggie plate for me? He said, yeah. This huge plate of vegetables, and it was asparagus and just off the chart. I think some potatoes, Brussels sprouts were in there, broccoli, and it was really well made. It was delicious. Everybody at the table, nobody said oh, your steak looks good, oh, your ribs look good. Everyone at the table said, that looks awesome. I said, it is awesome. And at the end of the meal, I felt great. They felt sick, I'm sure, from eating that much. My meal was cheap. Their meals were expensive. I went home and slept well. I'm sure the problem of digesting that meat is a big issue. And if you cook meat, you get heterocyclic amines, which are the grill marks on the steak or the piece of meat. And the smell of the meat, the thing that smells so good, and I'm not going to lie to you, it smells good. It's called polycyclic aromatic hydrocarbons. And those are also carcinogenic along with the heterocyclic amines. So, who benefited in this deal? I did. Oh, by the way, they paid for my meal too. So a lot of colleges now are offering plant-based meals. Most of the fast food restaurants, if you go into them, have a plant-based meal available. One of the burgers places, you just ask for a veggie burger, and they have it there. It's not even on the menu. In a desperate situation, you could always get just a sidebar. You can get pickles and lettuce and tomatoes and onions and make a big tomato sandwich if you had to. I've done that already in the past. I don't eat bread much anymore, but when I first went this way, I started doing that. And so there's always a way to do it, and it's always the least expensive way to go. You'll live longer, you'll feel better, you'll be full at the end of the meal. No reason not to do it. So let's see who's promoting plant-based diets. World Cancer Research and the World Cancer Research Fund call for choosing predominantly plant-based diets for a variety of vegetables, of fruits, legumes, and minimally processed starchy staple foods, and limiting meat consumption. Okay, so this is the World Cancer Research event. American Cancer Society recommends choosing mostly food from plant-based sources. American Heart Association recommends choosing a balanced diet with an emphasis on vegetables, grains, and fruits. Heart and Stroke Foundation, unified dietary guidelines developed by the American Cancer Society, American Heart Association, Institutes of Health, American Academy of Pediatrics call for plant-based on a variety of plant foods, including grains, vegetables, fruits, to reduce the risk of most chronic diseases. So every group out there that I know of, that's a disease group, is promoting eating a plant-based diet. So if there was some out there, if the American Heart Association said, nah, you don't have to do that, just eat as much meat as you want. All right, well, there's one. But the big groups who, want people to get better, looking for, searching for the cure, look at a plant-based diet. There's cancer hospitals now. I won't use a name because I don't know if they advertise on our stations or not. But there's several of them around the country. I think there's 8 of them. And they called me up one day and they said, we really want you on our staff. We want you, you're Dr. Joe. We want you on our staff. And I said, I just don't have time. It's about 45 minutes or an hour from where I work in my offices. They sent a limousine to pick me up, brought me down there, gave me a tour of the place for like 4 or 5 hours. A lot of the doctors and nurses knew who I was. It was kind of, oh, Dr. Joe, you're Dr. Joe. It was kind of fun. And their cafeteria had organic plant-based choices. And the patients, when they're being treated there, have options. They have chiropractors on staff. They have plant-based dietitians on staff, and they wanted me to go in there and help direct a lot of the holistic healthcare. They have acupuncture. They have medical care. They have surgery, and they have chemotherapy. So it's a combination. And I thought, isn't this cool? So many patients would benefit from something like this. And their success rate was substantially higher than the other cancer oncology hospitals. And when they wanted to build it, the other hospitals fought them. We don't want you here. So they had to make an agreement. This is insane to me. That they can only accept, and my numbers may be a little off here, but they're close, 15% of the people from Georgia, which is where the one hospital I visited is, and they have them around the country. The other people have to be from out of state. And yet they planned on expanding in 5 years, was it 10 years, I think, and they doubled the size of the hospital in like 5 years, and they still continue to build because so many people are going there. So why isn't this just incorporated? Why aren't healthy foods served in hospitals? I don't know that. And I'm hoping that shows like this and people like myself are pushing that. Let's get some decent food in the hospital. How about bacon and eggs in a cardiac unit? How about a hamburger stand in cardiac hospitals? I go nuts. I walk into a hospital, I see a fast food place there. Oh my gosh, what are we teaching these people? Well, it's okay to have burgers if you're in a hospital. It's what brought you there to begin with. And we're starting to see the trend going in that direction. Artificial sweetener. We have people who have had strokes and brain damage, give them artificial sweetener with aspartame. Aspartame is aspartic acid, phenylalanine, and methyl esters. Aspartic acid is an excitotoxin to the brain. It excites the brain and causes the nerves to fire faster than they're supposed to. What? Why would you give somebody artificial sweetener if they just had a brain injury? Makes no sense. But somebody famous once said, forgive them, for they know not what they do. So many hospitals and doctors don't know that aspartic acid is an excitotoxin to the brain. And when they hear this, then they're able to go back to their patients and say, yeah, let's start incorporating this. And again, I'm not picking on these people. Please, they don't know it. And that's why it's important. If you know these things, it's okay to say to your doctor, hey, listen, doc, I got headaches, and the number one side effect of aspartic acid, phenylalanine, and methyl esters is headaches. Maybe I should cut out the aspartame. What do you think? Or just do it. How's that for a concept? And again, I'm not knocking anyone. Please understand that. I'm not saying bad things about somebody else. I'm saying that we just need to educate the world on this. Because there's no argument. It's all logic. Logic says, yes, this works. All these groups, American Heart Association, Cancer Society, Stroke Foundation, Diabetes Foundation, are all saying the same thing. So let's start pushing in that direction. And there's tons of products out there too. So let me go into this, which I didn't plan on doing. But just because it doesn't have meat doesn't mean it's healthy. And that's where the word vegetarian has now gone to plant-based. Plant-based is most of your food coming from a plant-based source, a low or no processed plant-based source. There are vegetarian burgers out there made with processed soy, textured soy protein. They taste good. However, I don't like them because many times the soy is genetically modified soy. And then they take the soy and they pack it in, and you eat this, and it's really hard to digest. And you'll see this. You'll eat these things. You get gas and bloating, and you feel heavy, and you'll think, I don't like that. So brownies. I came in the other day. A lot of times when I come to the studio, I'll bring snacks. And just because I want my coworkers to be healthy, and I want them to see that you can snack on healthy foods. And I brought in they were raw brownies, and they were from a company, I won't say the name. And everyone was so excited. Oh my gosh, brownies, these are great. And these are really good. I said, yeah, they are really good, aren't they? So there are options. But every time I come to the studio, I got stopped only twice today. No, three times today before I went on the air with questions. Hey, listen, I got gout. What do you think about gout, Dr. Joe? Well, you got to stay away from meats, but you also got to stay away from high fructose corn syrup, because high fructose corn syrup, the fructose has to be converted into glucose, and in the process, it creates uric acid, and uric acid gets into joints, and that's gout. And he said, well, I don't like the high fructose corn syrup. I'd rather have plain sugar. And I said, well, plain sugar is 50% fructose, which then converts into uric acid. He says, well, I like stevia. I said, let's just use stevia. His name is Steve, too. I said, Steve, let's just use stevia. He said, great. I can do that? I said, yeah. He goes, Doc, love talking to you, man. It's awesome. And so just because somebody's a vegetarian doesn't mean they're healthy. So you can have brownies and cookies and cakes and donuts and pastas and breads and say, I'm a vegetarian, I don't eat meat. Eating dairy products in there. I'm not vegan, I'm vegetarian, you could say, and still be very unhealthy. So the term plant-based now has come to the forefront as, yes, you're not eating animal products, but you're eating mainly plants and not things like processed foods and breads and cookies and cakes and donuts and pastas and diet sodas and high fructose corn syrup. And I like that. I like the term plant-based better because if you want to get healthy, normally functioning nervous system, normally functioning digestive system, good nutrition. So as chiropractors, we're always looking at the nervous system always to see if there's anything wrong. You have 206 bones in the body. Any one of them can come out of place. So you got to put those back in place. You want to make sure the digestive system is working. If you have acid reflux, heartburn, burping, gas, bloating, we can actually adjust the stomach and the intestines if you have this condition, and that can help normalize your digestive system so you can absorb your nutrients. At least, please take Dr. Joe's Super Greens and Dr. Joe's Essential Source. It's the minimum amount of nutrients you should be eating every day. And I take a scoop of Super Greens, a scoop of Essential Source, I mix it with coconut milk, almond milk, and I drink it down at least once a day. If I have a big day, I'll take it twice a day or 3 times a day. If somebody's really sick, I'll have them take it 2 or 3 times a day. Tastes great. And it's relatively inexpensive for what you're getting, which is just crazy how much nutrients are in there. And travels. A lot of pilots and flight attendants will carry this with them and say, Doc, it keeps me alive. Everybody else is sick around me. I'm not getting sick. So Super Greens and Essential Source, those are on the website, drjoe.com. If you want to make an appointment to come see us, please, folks, stop suffering. The headaches, the neck pain, the back pain, the shoulder pain, in most cases, not all, in most cases, it's easy to fix. So if you're ready to get well, go to my website, drjoe.com. We'll get you set up an appointment to come see us. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. So people come to us every day, and the biggest complaint I get is, why didn't I do this sooner? Why did I suffer for so long, Dr. Joe? When I started taking the Super Greens, the Essential Source, oh my gosh, that stuff's amazing. So many of you are so depleted in nutrients that you get on something like Super Greens and Essential Source, it's a whole new world to you. You're blown away because your body's finally getting nutrition for the first time, maybe in years. And your body gets all excited, ooh, I'm getting nutrition. And you start to feel great. So why wouldn't you want to do that? It's a heck of a lot cheaper, way cheaper than a cup of coffee. Probably a half the price or a third of the price of a cup of coffee. So why wouldn't you do that? Stop suffering. drjoe.com. Make an appointment. Get the Super Greens, get the Essential Source. The B vitamins are there. We have probiotics. If you're on antibiotics, we have probiotics. If it's wintertime, at least take the vitamin D, Dr. Joe's Vitamin D. It's a liquid. Take 5 drops a day. It's 5,000 international units. Last year, I remember everybody was sick around me. My staff, patients were everywhere. People here in the studio were dropping out like flies left and right. And I said, I don't have anything. I don't even have a sore throat, a runny nose, nothing. But vitamin D, very important. We have Dr. Joe's Wellness Booster, which helps build white blood cells. That's a liquid as well. The Super Greens, the Essential Source, plant-based diet. And here's the kicker. You got to stay away from sugar. So even if you're eating a vegetarian diet, you got to stay away from the sugar because as soon as you eat that sugar, I'm telling you, don't believe me, try this. You're feeling good. You go to a party. As the holidays maybe come around and you start doing Christmas holiday parties or whatever, and you start eating breads and cookies and cakes and donuts and you got to try that cheesecake and it's so delicious. 2 days later, watch what happens. You get sick. Or when you get sick, count back 2 days and see what you did. Maybe 3 days. And you'll be amazed. You'll say, Dr. Joe was right. So stop it. So plant-based is better than vegetarian as long as you're doing it right. Of course, vegetarian is better than what most people eat. But if you want to make an appointment to come see us, drjoe.com, and all my supplements are on our website. A lot of supplements are on our website, drjoe.com. Well, they're all there, but they have a bunch of different ones. And listen to my podcasts. The podcast is called For the Health of It. If it's on iTunes, Stitcher, or Google Play, For the Health of It, download the podcast. We'd love to have you listen. And we have all my shows on my website, again, drjoe.com. So we got to cover protein. Gosh, time flies. I just need way more time. Protein, number one question I get, where do you get your protein from? Plant protein can meet all the requirements when a variety of plants is consumed and energy needs are met. So this is the standard that's used. If you're eating enough fruits, vegetables, nuts, and seeds to maintain the weight that you want to be at and maintain your energy levels, you're getting enough protein. Now, as you get older, your digestive system gets weaker. Your stomach acids start to drop. So we need to increase our body's ability to break down these proteins, whether it's from a steak or it's from a carrot. And so we have something called Dr. Joe's Digestive Enzymes. They're on the website too. And whenever I eat a plant-based meal, now that I'm older, I take the enzymes. If I feel like I'm getting sick, which very rarely happens, I will take the enzymes between meals. If you take Dr. Joe's enzyme support with meals, it helps break down the meal. If you take Dr. Joe's enzyme supplements on an empty stomach, they get absorbed, and the enzymes can actually help fight viruses, germs, and bacteria in your body. And this is why they say, well, be careful for people that have weakened immune systems, the very young, the very old. Well, one of the reasons the very old have a weak immune system is their enzyme levels are dropping. Raw foods, super greens, essential source, salads, broccoli, cucumbers, tomatoes, avocados have enzymes in them. And that can help the immune system. Then we take Dr. Joe's enzyme support if you're eating a cooked meal, and I do, and it helps break down the food more efficiently. Because you're not producing the enzymes like you used to, you may need them from an outside source. And so as long as you're eating enough food, you're going to want to break it down, break the proteins into amino acids, and your stomach is where most of that happens, and your pancreas kicks in later on and helps that out too. So you could take the digestive enzymes with that. But there's no reason why you shouldn't get all the protein you need from a plant-based diet. It says, according to American Dietetic Association, plant foods eaten over the course of a day can provide all the essential amino acids and ensure adequate nitrogen retention and when used in healthy adults. Thus, complementary proteins do not need to be consumed at the same meal. So the whole thing of food combining, I have to get all my amino acids in one meal. No. Whole proteins or complete proteins. No, you don't. Your body will take the amino acids and store them and use them when they need it. That's why it's important to have a healthy liver, and that's another reason you want to stay away from alcohol, which is one of the 7 deadly sins. I made that up, 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Because if the liver isn't working properly, you're not going to get your nutrients no matter what kind of diet you eat. So if you're eating a plant-based diet and sucking down booze, it's going to affect the liver. Sugar affects the liver. And so that's one of the reasons alcohol destroys livers. It's very similar to sugar. And sugar can lead to something called non-alcoholic fatty liver. So things like breads, cookies, cakes, donuts, pastas can cause fatty liver just like an alcoholic. And when I went to school, we cut open a cadaver. We look at the liver. It's fatty. We say fatty liver, and we got an A on the test. And what's caused? Alcoholism. Now, if you cut open a cadaver or a person, look at their fatty liver, and you say alcoholism, not necessarily. A lot of that comes from sugar. So plant-based diet is the best thing. Supplements like Dr. Joe's Super Greens, Dr. Joe's Essential Source. All my supplements, by the way, are plant-based. The vitamin D does come from lanolin, which is sheep wool. No animals are killed for it. But all the other ones are totally plant-based. So if you want to get some good supplements, go to my website, drjoe.com. If you need us to put together a protocol for you, we're more than happy to do that. Send us a message, drjoe.com. Patients send me messages all day, every day. If you want to make an appointment to come see us, if you have we're chiropractors, neck pain, back pain, shoulder pain, numbness, tingling, acid reflux, digestive issues, nutrition issues, stop suffering. Get off the couch. If you're driving your car right now, just remember drjoe.com, and we'll set you up a time to come see us. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. Everybody has questions about insurance. Just call my office. They'll answer the questions for you. If your insurance for some reason doesn't cover, which happens sometimes, it's only because the only reason we don't accept an insurance company is because they're such a hassle to deal with, or they just don't pay us enough. I've had insurance companies where the doctors drop out because they're losing money being in the network. So from a business standpoint, that doesn't work. And many times there's out-of-network benefits. So if you look on your list and a doctor isn't listed, call the doctor's office. There may be out-of-network benefits, which are better for you, cheaper for you than using your insurance. I know it makes no sense. But if you want to make an appointment, the website is drjoe.com. On the website, hundreds, well over 1,000 hours of podcasts. So go there, listen, pick the topics you want. We have downloadable version. That's on SoundCloud. Then we have the YouTube version. You could listen and or watch. However you learn, we want it there. If you like reading, we have 2 books. One is called Eating Right for the Health of It. I wrote that a few years ago. And my most recent book is Prescription for Extreme Health. Very good books, very easy to understand. And that's my goal, is I try to take everything that's complicated and break it down for you. But the number one complaint, why didn't I do this sooner? The answer is always, I don't know. So come see us, folks. My heart bleeds for you because patients come in the office, Doc, I've been meaning to come here for 2 years, 10 years, 20 years, 30 years. What took you so long? I don't know. I don't get it. But many times pain is due to pinched nerves. And if we can put the bones in the spine, the shoulder, the foot, the knee. One of my coworkers here, I've been working on his feet, and he just thinks he wants to name his kids after me, I think. Because when you put those foot bones back in place, the feet control everything. So feet, knees, ankles, shoulders, we want to get you well. So almost out of time, folks. The website again, drjoe.com. If you have any questions, send them to me through the website, and I'm more than happy to help you get well and stay well. Thanks for listening to For the Health Bit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.